When it comes to healthcare, vital signs are like the body's personal report card. They reveal how well the body's major systems are functioning, sometimes even before symptoms appear. Medical assistants take vital signs at nearly every visit because they give an instant snapshot of a patient's overall health. The 4 core vital signs, temperature, pulse, respiration, and blood pressure, work together like instruments in a band. When one goes off beat, the whole rhythm of the body can change. Temperature measures how well the body maintains internal balance. The normal oral temperature is about 98.6 degrees Fahrenheit, 37 degrees Celsius, though it can range from 97 degrees Fahrenheit to 99 degrees Fahrenheit and still be considered healthy. The body regulates temperature to keep organs working properly. Too high, and it can indicate infection or inflammation. Too low, and it may mean the body is losing heat faster than it can make it. Depending on the situation, temperature can be taken orally, tympanically, in the ear, temporally, on the forehead, axillary, under the arm, or rectally. Pulse measures how many times the heart beats per minute and reflects heart rhythm and strength. A normal adult pulse ranges between 60 and 100 beats per minute. You can feel this most commonly at the radial artery on the wrist, but also at the carotid, brachial, or femoral arteries. A faster pulse, tachycardia, might occur with fever, anxiety, dehydration, or exercise, while a slower one, bradycardia, might occur in trained athletes or heart disorders. Pulse isn't just about counting beats. It tells you how strong and steady the heart is working. Respiration counts the number of breaths taken per minute. The normal adult respiratory rate is 12 to 20 breaths per minute. When measuring, medical assistants quietly observe the patient's chest rise and fall without letting them know, so the pattern stays natural. Fast breathing, tachypnea, can indicate stress, fever, or lung issues. Slow breathing, bradypnea, may appear with certain medications or neurological problems. Every breath delivers oxygen and removes carbon dioxide, keeping the body's chemical balance stable. Blood pressure shows how hard the heart works to push blood through the arteries. It's measured in millimeters of mercury, and recorded as 2 numbers. Systolic, top number, which measures pressure during heartbeats, and diastolic, bottom number, which measures pressure between beats. The normal adult blood pressure is around 120 over 80 millimeters of mercury. Anything 140 over 80 millimeters mercury or higher is considered hypertension, high blood pressure, and can put stress on the heart, arteries, and organs over time. Hypertension can lead to serious complications like heart disease, kidney damage, or stroke if not managed. On the other hand, blood pressure that's too low, hypotension, can cause dizziness, fainting, or shock due to reduced blood flow. Accurate readings depend on using the correct cuff size, proper placement 1 inch above the antecubital space, and ensuring the patient's arm is at heart level and relaxed. Some facilities also include oxygen saturation, SpO2, and pain level as additional vital signs. Normal oxygen saturation should stay at 95% or above, showing that red blood cells are fully saturated with oxygen. Pain, often called the 5th vital sign, helps providers assess how discomfort affects a patient's physical and emotional state. Vital signs are much more than just routine numbers. They're early warning signals. A patient can look perfectly fine but show a dangerously high blood pressure, a fever, or a change in pulse that tells the body's story long before symptoms appear. Monitoring trends over time allows medical assistants and healthcare providers to detect changes early, intervene quickly, and often prevent complications. In short, vital signs are the language of the body, and mastering that language is one of the most important skills a medical assistant can learn.